Alright, I'm going to talk about how to associate common lab tests with the diagnosis. Super easy. There's not a lot of tests we do. We only do very few tests. The most common test we do is the strep test, flu test, RSV test, and the COVID antigen test. So let's get started. So this is one of the most common tests that we do for a throat infection. There's two kind of tests, rapid test and the PCR. We almost always do rapid test, which is the CPT code 87880. Well, you don't have to memorize the CPT code because it will automatically load when you do the chart slip pre-filled. Right, you just have to know 8780880 is rapid strep test. If you don't know it, just scroll down to that 8780 87880 and it will tell you it's the strep test. So what diagnosis to use with the strep test? The diagnoses are going to be already preloaded. You're not going to enter it manually. Okay. So I have organized in such a way that it's very easy to remember, and you don't have to go back to your Word document to see, okay, this is what goes with the strep test. No, you don't have to do that. It's just not going to work. J02, J03. Anything that goes with J02 and J03 goes with strep test. That's how you have to remember. The J02.0 is a positive strep test, streptococcal pharyngitis. And if the strep test is negative, we use the J02.9 acute pharyngitis unspecified because we don't know what bacteria or virus is causing the infection. And the same thing with .00 is a very specific diagnosis, right? J02.0 streptococcal pharyngitis. The same thing is J03.00 is acute streptococcal tonsillitis because the strep test came back positive. And if the patient has tonsillitis and the strep test is negative, then we use the code acute tonsillitis and unspecified. So bottom line, J02, J03, anything that start with those three, J02 and J03 goes with strep test. And then guess what? The the R50.9 is fever. Just to give you a heads up, or a clue, fever goes with everything, almost every test. You do the CBC, you do the strep, flu, RSV, any test you do, the fever goes. So if you don't find the above all the above four diagnoses and you see the fever, so use fever. So you're not going to see all these diagnoses in the same patient. You either going to see strep throat or pharyngitis or tonsillitis, streptococcal tonsillitis, or acute tonsillitis unspecified. You may see strep throat, strep pharyngitis, and fever together. That means you can put the strep pharyngitis before the fever, J02.0, then the fever. But if you don't follow the rule, you're still going to be okay. So don't worry about which one to put first. Of course, common sense has it that you put the strep test, more specific test first before the fever. Okay, but you won't get the J02.0 and J02.9 together in the patient, because if you see something like that, alert me, because that's not how it works. You don't either have a strep throat or you have acute pharyngitis unspecified. So the other most common test we do is the rapid flu test, rapid influenza test, 87804. We do sometimes do the molecular flu. It's very expensive. Molecular flu influenza is a PCR test. Expensive, so we use the rapid influenza test. So obviously you can see, the diagnosis of influenza, just like the diagnosis of strep pharyngitis goes with strep. Influenza diagnosis goes with influenza testing, but most of the time right now the patients come back negative for flu influenza test. So the next more specific test would be fever. Next diagnosis would be fever if the patient has a fever. And then if the patient doesn't have a fever, then just use a common cold URI. Or if you don't find the diagnosis of URI in this, when you do the pre-fill, just use nasal congestion. It's going to be there. One of these is going to be there, period. So of course, if you see fever and URI, which most likely you will see, then put the fever first, URI next. But if you put URI first and the fever next, nothing happens, we still get paid. But this is the order preferably you follow. If you see all of these diagnoses, which is going to be very rare, you can put J10.1, R50.9, J06.9 and nasal congestion in that order. So but you won't see that. Let's say you have all of these diagnoses, but if you remove all of these by mistake, R50.9, J06.9 and nasal congestion, we still get paid. One diagnosis is enough to cover the test. Fever is enough to cover the test. If you don't see anything else, if you just see the fever, use the fever. So influenza is like a severe form of a cold. RSV in babies causes bronchiolitis, or older kids it causes bronchitis. But we don't do this test on older kids more than 3 years of age. We do this test in kids at less than 3 years of age. So the rapid RSV is what we do, but in certain insurances we also do the molecular RSV, which is the PCR. We call it a mini PCR 87635, and the rapid is 87807. So obviously, again, the just like the J02 goes with strep throat, J21 uh, uh, goes with with RSV testing. J21.0 more specific because RSV test is positive. J21.9 it's acute bronchiolitis unspecified because their RSV test was negative. But what happens is, any patient who has a fever, a URI, nasal congestion, we sometimes do the test. So the RSV will be negative. The patient doesn't have bronchiolitis. The patient just has a fever and URI. So we use those diagnoses: fever, URI, or nasal congestion, whichever is there in this certain order: J21.0, R50.9, J06.9, or nasal congestion. Because I skipped the J acute bronchiolitis because you can either use J21.0 or J21.9. You can't never use both of them together, and they will never be there in the notes together, so they will never come into the charts like pre-filled. So if you see that all the testing is because it's respiratory and ear, nose, and throat conditions. You see, they all start with a J. J codes. So COVID tests, we do the 87811, which is a rapid test, which is a swab from the nose. And very rarely, almost none of you have seen this, the COVID antibody test. We do it like once a month if the parents request it. So it's always 87811. Very simple, just like the influenza and the URI, all those codes go there. Fever, URI, nasal congestion goes there, and on top you see the more specific code U07.1 because the patient tested positive for COVID. Now if the patient tests negative for COVID but the patient has fever or URI or nasal congestion and was exposed, then we use these diagnosis code in this specific order, fever and then exposure to COVID-19, or URI, or exposure and exposure to COVID-19. But if the patient is already positive for COVID, there is no reason to put exposure to COVID-19. It will not be there in the diagnosis of the nodes, and it will not be there in the pre-fill, so you don't have to worry about using the Z20.822 if the patient is positive, because you already have a diagnosis. Then you say, okay, we did the COVID test because the patient is positive for COVID. So fever goes with almost everything, URI goes with almost everything except the strep test. Sometimes we even use, if it's sometimes we may even end up using the URI with strep testing, but I never do that. So uh, if you have any questions, please let me know. In the next presentation, I'll show you how to remove the unwanted code from this specific lab test. All right, thank you so much.